Okay, keep in mind as we're going over the veins that veins actually drain tissues, which means that they take blood away from the tissue towards the heart. And of course, we're drawing them from the heart outward. So keep that in mind. So what helps drain the upper body is our superior vena cava. The superior vena cava will branch into the right and left brachiocephalic veins. Okay, so then extending off of each brachiocephalic vein, you're going to have 3 vessels. So the most internal vessel there, which is denoted by 3, is your right and left internal jugular. The middle is the right and left vertebral. So the internal jugular and vertebral will both drain the brain through the dural sinuses. The most external of these, which is the external jugular, will drain everything else in the head. So like your skeletal muscle, skin, other tissues. Okay, so once the brachiocephalic basically passes the external jugular, it then becomes the subclavian. So it's going to go underneath your clavicle. And then right when it gets to the armpit, we're just going to do a little region change. It's going to become the axillary just for that short amount of time. Okay, so the arm is different in the veins and the arteries. And this is actually true of most veins. We have both superficial and deep. So deep veins run nearby arteries. Superficial, obviously, are more external, closer to the skin. So I'm going to go over the superficial veins of the arm first. So after you've passed the armpit, going on the most lateral portion of the arm, it passes the head of the humerus. You have the cephalic vein. We'll go all the way down to the thumb. Okay, so coming off of this portion of the axillary, you actually have kind of 2 veins that emerge here. One that's going to be deep, so we're going to talk about that in a minute, and another one that's going to be superficial. So this is going to go down the medial portion of the arm all the way down. That's going to be called the right and left basilic vein. So those are superficial, and between those 2 veins, around the part where your arm bends at the elbow, we have another superficial vein. This is important for clinical significance. That is the median cubital vein. So that's where we take typically blood from. Okay, deep veins basically follow that of the artery. So you have the brachial artery on each side. Again, right at the elbow, it's going to split into the radial, which is going to be more lateral, and the ulnar, which is more median. Okay, now we can move on to the lower portion of the body. So these are all, everything else we're going to show is going to be returned to the right atrium of the heart through the inferior vena cava. Okay, so in the abdominal pelvic area, we do have a portal system, which means that blood is going to flow through 2 capillary beds before it actually enters a vein that will take it back directly towards the heart. So we do have a vein that's draining the spleen and the stomach. So we have the splenic vein, you have the gastric vein. So the splenic obviously drains the spleen, the gastric drains the stomach, then you have the inferior mesenteric, which is going to drain most of the large intestines. That will actually join with the splenic vein, and those are going to go into the liver and form what we're going to call the hepatic portal vein. Also dumping into the hepatic portal vein is the superior mesenteric, which is draining the small intestines and a small portion of your large intestines. Okay, so the hepatic portal vein has blood coming from this small intestines, which could be nutrient rich depending on the last time the person's eaten, could have any materials coming from the stomach that need to be broken down, any chemicals and drugs, alcohol, etc. So the hepatic portal vein is draining the capillary beds of these organs and taking it to the second capillary bed. So inside the liver itself, you have tons of these capillary beds, which we call hepatic sinusoids. So the liver can drop off extra sugar, drop off extra fats and proteins, or if it's in a state of starvation, it would pick up these extra that it's stored. And then it's going to take it to the blood, the rest of the body. So the vessel that takes blood away from the liver back to the inferior vena cava is simply the hepatic vein, which is very different than the hepatic portal vein. So hepatic portal vein materials have not gone through the liver yet. Hepatic vein, they've been cleaned and have the appropriate nutrient levels. Okay, now we need to talk about, actually before we do the legs, you do have the right and left renal arteries, which dump directly into the inferior vena cava. Okay, so the veins are very similar to the arteries. Basically, as soon as you get to the pelvis, you're going to have that split, and you're going to have the common iliacs. The common's going to split into the internal iliacs and the external. So the external iliac does a very quick change as soon as it's passing over the head of the femur. This would be a region change. It's going to change to your femoral, right and left femoral veins. Now extending off of the external iliac, basically as soon as the femoral comes, we have, and I'm going to stop drawing it on this side, so veins are mirror images of one another, so I'm just going to finish drawing on the left. You have the great saphenous vein, which runs down the inner portion of the entire leg all the way to the foot. Okay, the femoral does a regional change around the knee, changes to the popliteal. Okay, now at the popliteal, you're going to have, once you have that regional change, you have the anterior tibial that'll take it down the anterior portion into the actual foot, the dorsalis pedis. So this was femoral. This is great saphenous. This is popliteal, just for that short area. Then we have our anterior tibial, which takes blood or drains blood from the foot, dorsalis pedis. And then draining from the posterior portion of the leg, like the gastrocnemius and soleus, I'm doing it dotted just to show that it's posterior, you would have the right and left posterior tibial vein. And that is it for the veins that you need to know.